Now to a fight of a very different type here in Washington, and one that is shaping up to be a political battle of epic proportions. House Republicans are at war with each other tonight over the leadership's plan, depending on your perspective, to replace a faltering Obamacare with a better alternative, or just put a fresh coat of paint on a broken down structure that will remain in place. We have Fox team coverage. John Roberts is at the White House with what President Trump is doing to promote that new plan. We start off tonight with Chief Congressional Correspondent Mike Emanuel on a very tension-packed Capitol Hill all day today. Good evening, Mike.
Well, good evening, Brett. Two House committees are working this hour getting a first crack at this GOP health care proposal. The Democrat strategy appears to be trying to delay it, hoping that will be enough to ultimately stop it.
I said to you that I would like to make a motion to postpone the markup for 30 days. I don't understand why that is not in order at this time.
I move to table the motion, if it really is a motion.
Do we have it? Where is it? Can your staff provide it for us?
Yes.
When did we receive it?
Mr. Chairman, you were trying to rush this bill.
Some resistance from Democrats on the Republican effort to scrap and replace Obamacare.
You're afraid of sunshine. And we will insist that it be spotlighted, and the public is going to react, I assure you.
Let's not rewrite history here. You claim you had a CBO estimate. You did not. You had a letter. And it wasn't even based on the bill. It was based on specifications by a three-committee working group.
Ways and Means Chairman Kevin Brady tried to keep moving forward.
The most important thing for all Americans to know is that we will ensure our fiscally responsible legislation meets all the reconciliation instructions before it reaches the House floor.
Democrats took the opportunity to take swipes at the bill and even President Trump.
What this bill needs is some extreme vetting. We're being asked to vote without knowing how much it costs and without knowing what size it is.
The White House budget director predicted the Congressional Budget Office will weigh in soon.
The only question about the CBO, is it going to be really good or is it going to be great when that number finally comes out? I think it's going to be on Monday.
Although the White House press secretary notes CBO has been wrong on health care before.
If you're looking at the CBO for accuracy, you're looking in the wrong place. I mean, they were way off last time in every aspect of how they scored and projected Obamacare.
One criticism from some conservatives is the legislation doesn't fully repeal Obamacare.
If you just look at the bill text, the very first paragraph says it amends the Affordable Care Act. It doesn't repeal it. And so the American people want us to repeal it and replace it with something that is different.
Congressional sources say that isn't fair because full repeal is not allowed under reconciliation. House Speaker Paul Ryan continues trying to rally his Republican conference to support this package.
This is the covenant that we made with the American people when we ran on a repeal and replace plan in 2016. This is what our bill does.
After this morning's Republican conference meeting, a conservative said he didn't think the GOP plan would work.
We're dealing all with coverage and nothing with cost containment, price reduction, health care, right? So we're designing a system that is not going to lower costs, and that's the big deal.
A White House ally emphasized the stakes are incredibly high.
If the Republican conference doesn't pass this, our whole agenda goes down the tubes. We don't do tax reform. We have to get Obamacare repealed and replaced before we can begin tax reform.
Fox News has confirmed Republican Whip Steve Scalise asked GOP members in conference today if they're with the president in favor of this package or with House Democratic leader Nancy Pelosi trying to push conservatives to get on board.